In this video, I'm discussing about a recall communications that is about exchange transfusion. So the task, it is come on 2020-2019, 2 times come. The task is that a 40 hours old baby with severe jaundice secondary to ABO incompatibility. The direct com is positive, G6PD is negative. Total serum bilirubin 420 to 470 despite intensive phototherapy and IV fluids. Talk to the mother about the need of exchange transfusions. Use simple language only, do not elaborate more like talking connected us. So we are here to take the exchange transfusion consent because ABO incompatibility occur and the level is higher than the phototherapy. So how can we do that? First, as usual, IRCAP, introduce myself, making a repo, taking the consent and agenda will tell and the any attendance needed and prior knowledge I'll ask that. So I'm here to take with you about some plans we have for Ali and hopefully by the end of the meeting we can take your consent. But first tell me how much do you know about Ali's conditions? So mother is explaining dot dot dot. Okay. Would you like anyone to be here? No. Actually, this is why our consultant asked us to talk to you to take a consent for doing a procedure called exchange transfusion or changing his blood. Have you heard about it before? No, I didn't. Then we'll draw a picture like a baby, like it is lying down on umbilicus, just there is a blood tubes we picture. So I'm explaining the procedure very easily. Can you please follow this drawing? So it is a procedure through which we will put a small flexible tube through his blood tubes in the belly button. Umbilicus is belly button. After applying a cleaning lotions, also we have to fix it in the place by sutures and we'll take an X-ray picture to make sure it is in the right place. Are you with me? Okay, doctor. After we make sure that it is in the right place, we will remove the blood loaded with a high yellow pigment and we will give him a blood without this yellow pigment. So the main procedure is that first we will numbness cream, apply lotions, everything in a cleaning procedure. We just fixed a tube, blood tube inside a belly button and fixed it with a suture and take a X-ray that it is on the correct positions. Then by that we will remove remove the loaded blood with a high pigment that is called bilirubin and exchange the blood. Okay, doctor. So the mother is asking, is there any alternative? Yes, there is a medicine called immunoglobulin, but it can cause severe allergic reaction and this is not could be predicted. So if alternative asking mother, so immunoglobulin is an alternative, but it has severe allergic reaction. That's why we are not giving that. Now, what about light therapy? What happened? Unfortunately, the level of yellow pigment in blood is very high, and we need to do is as soon as possible. So, yellow pigment is above the level. We can draw a pictures like this level is plot against this level is phototherapy. This level is exchange transfusion. So already it crossed the level of phototherapy. Now, why? Why we are doing this procedure? If we don't do this exchange transfusion, what can be happen? The drawbacks will tell. So as this yellow pigment is called bilirubin, if it is increased, will cross the his brain, and unfortunately, if this happens, it may cause some really catastrophic effects. I'm so sorry to tell you that if the level is very high, it may make him not to able to move. He may not able to speak. He will have some learning difficulties, and that is why we need to do this procedure. So if we not do the procedure, yellow pigment will be that is called bilirubin will be high. It cross the brain, causes catastrophic effect like the child unconscious, seizure occur, fits occur, unable to talk, unable to movement. So we don't want that. Now, what are the drawbacks of this procedure? First of all, definitely for any procedure, there are some drawbacks. First of all, there is a risk of catching bugs, but as I have mentioned, we will apply cleaning lotions and it is done under complete cleaning measures. So also there is a risk of misplacement and that is why we will take the X-ray picture of this tummy to make sure it is in the right place. Also, there are risk of displacement and that is why we fix it by sutures. Adding to this, some children later on may have a blood clot in the blood tube of the liver and we will follow him up and if this happens, we'll interfere immediately. So the complication will tell the drawbacks and also tell how can we prevent. Like catching bug, we are doing cleaning procedure. Pain, belly button is really painless. I will coming later. That means displacement occur of the sutures, but we fixed it with the suture. Already taken X-ray or fixed it, and these are sometimes blood clot occur. If blood clot occur in the blood tube, we will interfere that immediately. Next, so can be asked that is he will suffer from pain? Luckily, the pain sensation in the belly button is very minimal. So pain sensation in the belly button is very minimal. Do you have guarantee this blood to be safe? We do blood test for you and your baby. We are sure that it is safe and we get it from the blood bank when it is screened for most of the bugs. So it is already screened. It is really safe. We will ensure. Can I attend the procedure? Actually, it is very long process, exhausting you physically. You can follow us through the window and we will assign a nurse to explain for you step by step. Finally, it is your decision if you want to attend. So it is really long procedure. You can be exhausted. So a nurse will be, you can over window. You can follow that, nurse will join you. So, okay, I will take 1 or 2 days to think about it. At the matter of fact, we cannot wait for 1 or 2 days. It is really urgent. You need to think about it within a minute actually. We can give you some leaflets about it. You can revise them and must tell me your decisions as soon as possible. We cannot wait. Okay, I'm so sorry. If you wait and the level of the yellow pigment continues to rise, it will cause the catastrophic effects I have mentioned. Can I attend during this procedure? Best not attend for better infection control, but you can follow the procedures from a window and there will be a nurse with you, will explain every step. Okay, I will think about it. Great, and please, if you have any question, you will find us here. Do not hesitate. I will give some leaflets to read them quickly, waiting for your decision as soon as possible. So it is an urgent situation. We can give maximum 1 or 2 hours, but we have to do the exchange transfusions. This is all about exchange transfusion consent communication. Thank you, everyone.